Biology and medicine are really, really tough problems. If you could solve these by being smart and working hard by yourself, we would have solved them already. It's hard to think of a single biological discovery or a single medical cure that was done only by one person working alone.
The global burden of disease is a super dynamic collaboration. We started one toolkit 30 years ago, and now there's a tremendous amount of energy about machine learning, how you apply some of the advances in computer science to what we do. And what we want to make sure is that we've got all the people who are sort of at the edge of the analysis and on the methods, so that in 5 years there may be something completely new that'll drive the sort of innovation in the study. And I think we've been successful by having a multidisciplinary collaboration.
So biology and medicine requires serendipity. You have to be willing to go out and look for luck. And so one of the things that I teach my students is how to, if you will, engineer your luck. Can you be deliberately lucky? And so the ability to look at a problem from many perspectives is key. So if somebody's an expert on a problem, but they don't know how to solve it, and another person's an engineer who can solve problems, but they don't know what the big problems are, they naturally want to work together because that's how you have more impact. And so I call this strategy architecting. I try to bring together people in small groups to help them work together. And now our group at MIT, we collaborate closely with probably about 100 groups all over the world. And that's at the core of how we innovate.
Chris has training in health economics and medicine. I have training in demography and epidemiology. Those were good basic sciences, but they weren't enough, obviously. And as we've evolved, we've got more and more disciplines involved.
In terms of figuring out what are people's health problems and then getting people to use that information, the most important step in that process is for people in each country to understand the data, the methods, and the results, and to really own them, to be a co-owner of them. And that model of sort of co-ownership of the study means that you have a whole group of people who will then take up using the results in that policy context. 2-3 weeks ago, our collaborative team in India published, I think, 6 analyses around the burden of disease by state. And it was the front page of every major Indian newspaper. You had the government saying that this is really important and we're going to act on this. So that model of co-ownership, I think, is the right model, and we're going to keep investing in building that collaboration.